ladies, how are you doing? I hope you are doing well and welcome to today's session of learning. It's been a while since I did a video. I missed you guys, and today I'm back and I want us to learn on a very interesting topic. This is for those ladies who have newborn babies. So today I want us to learn about cord care, because I notice many moms don't know how to take care of the cord when they go home. So babies end up getting infection, okay, at the cord, the stump. So today I want us to know how are we supposed to take care of the cord at home, okay? So karibu. If you are new here, feel most welcomed. If you're a member, karibu tena. If you have not subscribed, please consider subscribing because it helps to grow our channel. So let's go straight to the topic. When you're discharged from the hospital, you will be taught how you will take care of the umbilical cord until it falls, okay? So I know you were told in the hospital. So today I'm just here to remind you, because I know you can easily forget, especially for the first time moms. You can easily forget, or maybe when you are being taught by the nurse, you were not keen. So welcome to this video and let's get to learn, okay? So number one point, before you take care of the cord of the baby, okay, make sure anytime before you touch the cord, make sure you wash your hands, okay? Before handling the cord stump, make sure you wash your hands. Why? Because our hands are not clean, they are not sterile, okay? We touch things even in the house, and because of touching area surfaces in the house, if you go direct and touch that stump without washing your hands, you may end up contaminating it, okay? So infection will set in, and that is how sepsis will set in a newborn baby, okay? So before you handle the cord stump, number one, make sure you wash your hands. Okay, another point, when you are at home, the umbilical cord falls off between first week and the second week, okay? Mostly that is when the umbilical cord falls off. So if you see the umbilical cord of your baby extends beyond 4 weeks, if the cord does not fall off beyond 4 weeks, you should go back and report to your doctor, because now it has delayed, so that the doctor can examine the baby and know what's going on, because it is supposed to fall off between the first 2 weeks of life. Number 3, let the umbilical cord fall off naturally, okay? Do not be tempted. You see, when the cord is healing, it heals, and then you might see imebakisha a small string. Do not be tempted to pull it, even if it is like a small string holding the stump. Don't touch it. Let it fall off by itself naturally, okay? Is that clear? Okay, number 3, keep the stump clean always and dry. Clean and dry. So in the hospital you will be taught, utaonyeshwa, utafunzwa vile unafaa kuosha cord. You will be washing it twice a day, okay? In the morning when you wake up, get a cotton wool. Get a cotton wool. Depending on the instructions you are given from the hospital, some hospitals, you might be given chlorhexidine. This you will be putting drops, okay, on the cord stump, or you will be taught how to wash the cord using water and a clean cotton wool, okay? So in case you are using water to clean the cord of the baby, what you do is get a clean cotton wool and get clean water in a bowl, and then dip the cotton wool in the water and then squeeze it. Then just swipe the umbilical cord. You can just hold it and then swipe it round 3 times, okay? Swipe it 3 times, and then 3 or 4 times depending on how fast it will get clean. When you are done, what you do, unapanguza, look at it, utupe, get another one, dip in water, dry it, panguza, angalia. So ukipanguza mara ya kwanza, ya pili, ya tatu, by the time unafika the 3rd time ama the 4th time, itakuwa imekuwa safi. So and then now use a dry kagoz or cotton, make it dry, okay? Do not leave it ikiwa wet. Sawa, do not leave it ikiwa wet. Make sure you leave it clean and dry. Do it twice a day so that ipone haraka. Number 3, don't put your baby in a tub of water until the stump falls off, okay? This is what I can advise moms, because ukimweka mtoto kwa maji mingi in a water tub, you might not be able to dry that cord kabisa, okay? So for me, okay, some moms prefer to wash the babies immediately wamezaliwa. They wash the babies. That is if you are able to make sure the cord is dry vizuri, because if you do not leave it ikiwa dry, then infection will set in. Sawa. So if you know you are not sure that ukidip mtoto kwa tub kwa maji mingi utaweza kuosha na kukamua hiyo stump ikue dry kabisa, do not put your baby in a tub. Just do what? Sponge bath your baby, mpanguze tu until the stump falls off, and then sasa uanze kumwosha kwa maji mingi, okay? Another point, watch for signs of infection, okay? How do you watch for signs of infection? Number 1, foul smell. Make sure that cord stump haina harufu yoyote. It should not have any smell. The moment you realize that imeanza kukua na foul smell, inanuka vibaya, then that means imekuwa infected. Number 2, watch for signs of if it's draining anything, okay? When it's infected, drain some yellowish liquid. If it's draining yellowish, then it means it has been infected. Actually, inafaa kukua dry. It should not be draining anything. So if it's foul smelling, and then if it's draining some yellowish stuff, then that cord is infected. You should go back to the hospital. Another thing, watch for signs of swelling. Angalia kama ime swell, Okay, angalia if it's tender, if when you touch that stump mtoto analia, it should not be painful. That cord stump should not be painful. Unafaa kuishika, unaishikilia vizuri, unaosha. But if ukishika mtoto analia, that means it's not okay. Okay, you should seek medical attention, and then check for bleeding. Okay, kwanza when you get home, make sure unaangalia that cord clamp. Kuna hiyo clamp imewekwa hapo, something that looks like a peg. It's called a cord clamp. Make sure it's in its place. Isitoke. Let it stay there until the cord falls off. If you notice that kuna kadamu, some blood discharging from the stump, make sure you seek medical attention. Another thing, fever. The moment mtoto wako anaanza kupata joto, then what happens, most neonates, hii cord ndio inaletanga mtoto anapata infection, anaanza kupata joto. So make sure mtoto akianza kupata joto, make sure unaangalia nini stump yake vizuri, ndio uone kama ndio imepata infection. Okay, another point, watch for active bleeding. Okay, then if there's bleeding, that means your stump imetoka haraka, it pulled too fast before it got to heal, ama before its time. Okay, so if the cord pulls off so fast or too soon, then there will be bleeding. So make sure you watch for any signs of bleeding. Be very keen. If you notice bleeding from the umbilical cord stump, report to the doctor. And then if it exceeds 4 weeks, seek medical attention. That one I told you as the second point. And then ensure baby's poo doesn't get in touch with the cord stump. How? Anytime mtoto anapoo, just change the diaper almost immediately. Okay, because if the poo gets to the cord stump, then hiyo imekuwa infected, itapata uza very fast, it will be infected. And then try to keep it clean and dry. Don't cover the cord stump with the diaper. The time unavalisha mtoto wako diaper, ukishaifunga, fold it, ifunge kwenda chini, and let the cord stump lie on top. Do not cover it inside the diaper. Okay, and then when you are dressing your baby, make sure you do it with some loose clothing, zile zenye hazimfinyi, because this space needs some aeration, okay, for it to heal. For the stump to fall off, it needs cleanliness, and then dry, and then free aeration for it to heal and fall off. Okay, another point, change diapers frequently, which I have told you. Do not let poop get to the cord stump. And then if you notice a swelling or bulging at the belly button, okay, ukiangalia mtoto unaona amefura hapo kwa cord, hapo kwa kitovu, unaona ni kama imebulge kwenda nje ama imefura, that baby might be having an umbilical hernia, okay, which sometimes is so painful. So ukinotice kuna hiyo swelling, bulging at the umbilical area, seek medical attention. Daktari will examine the baby and he will let you know if the baby has an umbilical hernia and the way forward. Okay, yes, sawa. Those are the few tips I wanted to give you about cord care, because I know these ones are very important. They are important. for the sake of the baby, you see this baby, this neonate ni mdogo sana, immunity yake haija develop, and then now just because haujakuwa careful, imagine, and then apate neonatal sepsis because of the umbilical cord stump, and then unajua hiyo sepsis itakuja kwa nini? Because of you, because you will not be careful when you are handling it or when you are taking care of it. So please protect your baby, protect your baby, your neonate. Usianze kuenda hospitali mapema because of sepsis secondary to poor cord care. Sawa. So if you had forgotten, at least I have reminded you. So, and if you have any question, ask me down there in the comment section. So thank you so much for watching this video. See you in the next session of learning.